Hi, I'm Dr. Anushka Chava, Deputy Chief Medical Officer at Vitality. Clinically Speaking is our advisor series of short videos featuring clinical updates and expertise from Vitality clinicians and experts in their fields. Each video will cover topical clinical subjects, including healthcare trends, data insights, clinical research, and the role of healthcare in the insurance sector. A new Clinically Speaking episode will be available every month on the Vitality Advisor channel. That can be accessed via YouTube. On today's episode, we'll be exploring post-COVID syndrome. To help me do this, I'm delighted to introduce Dr. Jane Benjamin, a general practitioner at HCA Healthcare UK, and someone who has been involved with treating and diagnosing post-COVID syndrome in her clinical practice. Hi, Jane. Lovely to meet you.
Hi, Anushka. Thank you so much for asking me to talk on this episode.
Great to have you, Jane. Just before we start, why don't we tell our listeners what we'll be talking about today? So in this interview, Jane will be helping me answer some of the key questions out there right now. For example, what is post-COVID syndrome? How long does it last? How can it affect individuals and the population? How do GPs diagnose and treat this? And finally, what can insurers do to support members with post-COVID? So Jane, let's kick off. What is your understanding of post-COVID syndrome and how is it different from common COVID-19 conditions?
Well, I think the first thing to define is the acute COVID-19 infection that all of us know about. And that is your initial symptoms that you have and a time when you are infectious and can spread it to others. Following COVID-19, most people make a recovery within a few weeks. However, there are some people that go on to develop symptoms which progress for some time. If the symptoms continue for more than 12 weeks, that would be classified as post-COVID syndrome. But I'm sure a lot of you have also heard about long COVID. And long COVID are the individuals who have symptoms for more than 4 weeks. So often the term post-COVID and long COVID refer to a very similar sort of group of patients, and they would be managed in exactly the same way.
Thanks, Jane. A very interesting distinction to make between long COVID and post-COVID. So if we think about both long COVID and post-COVID, why do you think it's important for us to know about these conditions today?
So there are a few different reasons why people with ongoing symptoms should be seen. And the first is to make sure that your ongoing symptoms are not a more serious complication of COVID-19. We know that it can cause underlying cardiac issues, lung disease, and in some cases, blood clots. So it's important to exclude those. Secondly, there's a group of patients who think that their symptoms are related to COVID-19, but they may be due to another underlying cause. And in some cases, cancers can go undiagnosed in patients who think they have ongoing COVID symptoms. And in our practice, we've had a few patients who've fallen into this group. And finally, it's important for those with ongoing post-COVID and long COVID symptoms to get the appropriate support from their GPs in order to aid their recovery.
Thanks, Jane. And in your experience, how do patients generally present with post-COVID or long COVID syndrome?
Well, that is a very interesting question because basically long COVID or post-COVID can present as absolutely anything. So the most common presentation is normally a relapsing and remitting fever, shortness of breath, and ongoing fatigue. And in our practice, those are most commonly the patients we see, together with patients with ongoing headaches, breathlessness, palpitations, dizziness, and chest pain. However, as I mentioned, it could be anything. There's a huge host of cardiovascular and respiratory presentations, musculoskeletal aches and pains, ear, nose, and throat symptoms, which can be ringing in the ears. We have all heard about the loss of taste and smell. And with it comes a huge neuropsychiatric side of it. So a lot of anxiety and depression that comes with being unwell for such a long period of time.
That's understandable, Jane, and quite difficult to differentiate from the anxiety, depression, low mood, and potential social isolation we've all felt or are feeling as a result of COVID-19 and lockdown and such likes. So I guess as a GP, how do you diagnose and treat patients with this condition? Is it inpatient or outpatient?
So the patients that we would see would be outpatients, and anyone presenting with post-COVID syndrome to their GP would be managed in a very similar way. The important thing is to rule out the underlying severe complications, and that would be done through physical examination and a set of tests looking at an ECG, which is a tracing of the heart, lung function tests, some blood tests to exclude any blood clots, underlying heart damage, as well as some specialized tests looking at interstitial lung disease, which basically checks for a drop in saturations while patients are doing some exercise, and a test for blood pressure that looks for a condition called postural orthostatic tachycardia syndrome. Now, this is something that has been linked to long COVID, and it's actually very interesting. Somehow the virus causes a dysfunction in your autonomic nervous system. So normally when you stand up, your blood pressure compensates. But in this case, your blood pressure drops, you feel dizzy, you get palpitations, and in some cases, chest pain. And what the process you will go through is you will have a set of blood pressure readings done to check if your blood pressure drops and you fall into this group of patients. Following on from your initial assessment, if your doctor identifies any underlying concerns, you would be referred on to secondary care for further investigations. For those who don't have any underlying concerns, you will be managed appropriately according to your needs.
Thanks, Jane. It sounds like it's a very complex condition and one that is, as we know, evolving and emerging. Do we know how long it would last?
We don't know yet, and I think as more data comes out, we'll be better informed. We know that based on the data from the Office of National Statistics, 1.1 million people were living with long COVID, so those are symptoms after 4 weeks. They estimated that there were 697,000 people living with post-COVID syndrome, so that's symptoms after 12 weeks, and 70,000 people with symptoms that are still present after a year. But it will still take some time before we get more data and know more.
That makes sense, Jane. And I guess with new research and initiatives being put into practice, that would improve our understanding of the long-term implications of COVID-19. I have another tough question for you, Jane. Is there a specific age group or demographic that seems to be more at risk of the long COVID or post-COVID syndrome?
So yes, females are more at risk, those between the ages of 35 and 69 years of age. The King's College Symptom Study showed that people who present with more symptoms in the first week, and that would be 5 or more symptoms, were more likely to go on to develop long COVID or post-COVID syndrome. So those people that have fever, shortness of breath, bodily aches and pains, coughing, fatigue are more likely to develop it. People with an increased BMI are also at risk, and those with an underlying medical condition where they struggle to exert themselves anyway are more at risk of developing it.
Got it. Thanks, Jane. It sounds like the high risk indicators that were similar for COVID-19 also apply in terms of long COVID and post-COVID syndrome.
Although in saying that, with acute COVID-19, males were generally more at risk, and there was a big concern regarding ethnic minorities. So that in particular doesn't necessarily match up with the long COVID story.
That's really insightful, Jane. Thank you for sharing that. So I guess my next question is, how do you treat patients with long COVID or post-COVID syndrome?
So provided all the urgent, serious complications have been excluded, the patients who we would see would be treated through individualized support. It's important for patients to pace themselves, prioritize, and set realistic goals. It's important for them to conduct their activities of daily living within their means and within their exercise tolerance. We advise that people should slowly increase exercise and work as tolerated. And there's an excellent website that you can have a look at called yourcovidrecovery.nhs.uk. And this has a huge host of resources available for almost every symptom that you could experience from COVID-19. For individual symptoms, these are managed holistically. Patients with ongoing coughing, breathlessness, and breathing pattern disorders would be managed by physiotherapy. For patients with ongoing anxiety and depression, we would refer them to the necessary counsellor or psychologist, and in some cases, medication may be advised. It's important to ensure that patients get adequate sleep, and we can assist with this. Gut health is another area that we need to optimize, and probiotics are really beneficial. For patients who suffer from ongoing dizziness, from postural orthostatic tachycardia syndrome, simple measures such as by increasing fluids, increasing salt in the diet, and slowly getting up from sitting to standing, as well as compression stockings, are beneficial, together with reducing alcohol and caffeine. And finally, those patients who present with loss of taste or smell do really well from adding in a high-dose fish oil and a concept called smell training. And it would be interesting for you to have a look at this online. You can see that these are all very simple processes that can be advised by GPs and are primary care based that can make a huge difference in individual lives.
Thank you, Jane. I will definitely look up the smell training online. It sounds like a very interesting treatment regime. And Jane, I've read a little bit about a multidisciplinary approach into managing long COVID and post-COVID syndrome patients. Can you tell us what that is and what does that mean?
Because these patients present with such a complex array of symptoms, together with such a great deal of anxiety and depression associated with their underlying condition, patients do really well with a collaborative approach. So that's between a doctor, a physiotherapist, and the physiotherapists generally help with underlying breathing pattern disorders, they help with exercise tolerance, and a psychologist to help with the underlying anxiety and depression. And in some cases, patients who are referred on to secondary care, their specialist would be involved in that multidisciplinary team.
That makes sense. So taking a holistic approach to the patient and their needs.
Correct.
And Jane, what happens to the patients with post-COVID requiring ITU? Are we seeing those sorts of cases come through?
So that's a very different group of patients. And it's interesting because in our practice, we don't necessarily see those patients. And I think in a lot of primary care practices, they generally see the patients that don't end up in hospital. Mm-hmm. The patients that end up in hospital and previously in ITU are really unwell. And of those patients that are discharged, there is a high readmission rate in those patients. About a third of them are readmitted to hospital. And it has been shown that 1 in 10 of them may actually not survive following this episode. So that is really a very different group of patients that we don't necessarily treat in our practice, but they would be managed by specialists.
Thanks for sharing that, Jane. And is there anything we can advise our members and our listeners to do to prevent them contracting post-COVID or long COVID syndrome or experiencing the symptoms you describe?
So I think the most important thing is to get vaccinated, because by being vaccinated, you reduce your risk of getting COVID-19. And what's really interesting is that we know you can get COVID twice. So a lot of people think if they've had it, they don't need the vaccination. But I would advise everyone to get it. For those people that have already had COVID, unfortunately, there's nothing that we know of that you can prevent post-COVID or long COVID syndrome. The most important thing would be an early primary care assessment in order to exclude the complications, which I've mentioned previously, to make sure that there's no other underlying cause for concern, and in order for your doctor to help aid and guide your recovery.
Thank you, Jane. It sounds like all the initiatives you're putting into place in our practice and in your practice today are helping prevent the seriousness of long COVID and post-COVID syndrome. I guess the one last question, which is probably for myself to answer, is what is Vitality doing in this space and how are we supporting our members? So Jane, as you mentioned, we offer our members GP-led consultations that allow for clinical assessment and triage and examination to understand the underlying symptoms and any of its causes. So we will fund GP-led assessments that look at pulse oximetry, temperature, blood pressure, the respiratory tests you mentioned, an ECG, blood tests, and the lung function tests, as you talked about, Jane. We also support GP-led referrals to specialists. So Jane, as you mentioned, cardiology, neurology, and respiratory conditions are part of post-COVID and long COVID syndrome. GPs that see our members can refer patients onwards to those specialities for further investigation and, as you mentioned, to rule out the sinister causes. In addition, noting that there are neuropsychiatric symptoms associated with long COVID and post-COVID syndrome, our Talking Therapies benefit enables a member to access multiple sessions of counselling, therapy, and/or cognitive behavioural therapy to help them deal with some of the symptoms we spoke about, such as anxiety, depression, low mood, and social isolation. And finally, for those members that are struggling to return to activities of daily living, we offer physiotherapy and, in specialised cases, speech therapy, for example, if members have been intubated in ITU, in order to support them to return back to their activities of daily living. And our Vitality programme, consisting of rewards and partners and incentives, hopefully provides the final catalyst to empower our members towards better health outcomes. Jane today has helped us better understand post-COVID syndrome. She shared with us the breadth of symptoms and conditions one may experience under the label of long COVID and or post-COVID. Jane has also kindly provided us with some insight into how GPs not only diagnose but also treat this condition and explained some of the challenges with doing so. It's very apparent from our conversation today, Jane, that post-COVID syndrome and long COVID are emerging and evolving conditions, and one where the clinical research will continuously grow as time goes on. It's important that we, as providers and as insurers, communicate these changes to our patients and our members to ensure that they stay up to date with the relevant information that is available. It is also important that we reassure our listeners that the majority of patients do recover from either acute COVID-19 infection, long COVID, or post-COVID syndrome. And it is expected that only a few and a minority will experience the challenges we talked about today. That being said, those that do experience them, we appreciate it's a difficult and distressing time for our members. And therefore, at Vitality, we continue to provide holistic, personalised care that is tailored to member need and ensures that they can achieve better health outcomes through their treatments. I'm Dr. Anushka Pachava, Deputy Chief Medical Officer at Vitality, and you've been watching Clinically Speaking. Thank you, Dr. Jane Benjamin, for joining me for this episode.